My name is Angie Gann, and today I'm joining you to talk about health, safety, and universal precautions in your Introduction to Child Care class. We're going to talk about several important factors today that deal with health and safety. The first one we're going to talk about is hand washing. First thing you need to know about hand washing is when. When do I wash my hands? You're going to wash your hands after each diaper change, even when gloves are used. You're going to wash your hands after helping a child go to the toilet. You're going to wash your hands after touching any body fluids directly or indirectly. This includes saliva, snot, urine, feces, or blood. This means when you go to wipe a child's nose, even using tissue, afterwards, after you throw that tissue away, you're going to go over and wash your hands. You're going to wash your hands before, during, and after handling of any food. You're going to wash your hands every time you get a chance. I cannot stress enough that you can't wash your hands too much. Wash your hands as often as you possibly can. Next, we're going to watch this video from the CDC and how to actually wash our hands. I know we all think we know the best way to wash our hands, but actually there is a way that makes sure that we get our hands as clean as possible.
Washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day.
Okay, we had a little bit of technical difficulty. We're going to try that video again. Once again, this is from the CDC.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day. Throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dryer. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! no more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
So it's important for you to remember all those hand washing steps as you're getting ready and going about your day. Next, we're going to talk about diapering. Infants and toddlers. Wet and soiled diapers and other clothing shall be changed promptly. We do not want our children to be in wet or soiled clothing or diapers for any length of time. No infant or toddler shall be left unattended while being diapered. We need to be standing directly in front of them with our hands on them during the diapering process. It only takes a split second for an accident to happen, particularly when a child is on a changing table. No infant or toddler shall be diapered on the floor. This may be something that you do in your family, but it is not something that we do when we're in a child care center. Staff shall always, when diapering, wash their hands with soap and water before and immediately after diapering, just like we saw a minute ago. We want to use clean single-use disposable gloves, which will be used for diapering each child. We want to clean our diapering areas, and our diapering areas shall be separate from our food service and preparation areas. We never ever prepare food or sit food in our diapering areas. Next, we have a video that will show us the correct way of diapering.
I'd like to demonstrate caring for our children and Idders and Eckert diaper changing procedure. The first thing you need to do when changing a diaper is prepare your station. You need a hands-free diaper pail to dispose of the diaper. Hands-free, meaning you use a foot pedal. If you have a station where you can open the door and leave it open, put it under the sink like that. If not, pull the trash can out and shut the door. Since I've touched the trash can, I need to wash my hands before I begin. So I turn on the water, I wet my hands, I get soap, and I begin to rub. I need to do it for 20 seconds. So you can either count in your head, or you can count out loud to model for the children. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Then you rinse. Grab your paper towel. Drying your hands thoroughly before using the paper towel to turn off the water. Now I'm going to prepare my station. I need to get a diaper, and if you have a ledge that you can put your item on, instead of putting them directly on the diaper changing table, that is the best. So I'm going to put my clean diaper, and I'm going to grab my wipes. I need one clean wipe for my hands, one clean wipe for the child's hands, and a couple of wipes to clean the child's bottom. Remember, never put your white box on the diaper changing table. This is a dirty surface. Next, I'm going to grab my gloves. Again, do not bring the glove box to the diaper changing surface. I'm going to put on my gloves and get my child. Now I'm ready to begin my diaper changing. So I lay the child on the surface. The minute I start to open the diaper up, I am now dirty. So I don't want to do anything else but care for this child in their diaper. I'm going to wipe top to bottom and leave the diaper under the child. Grab my first wipe top to bottom and leave it on the diaper. Wipe top to bottom and leave it on the diaper. She's clean. I'm going to grab my diaper and put it directly into the trash can, making sure to keep track of my child. Then I'm going to take off my gloves, pinching from the middle, and then up and in, and put it in the hands-free diaper changing, keeping an eye on my child. Next, I'm going to wipe my hands with a clean wipe, throwing it into the trash can. The child's hands with a clean wipe, throwing it into the trash can. Now that my hands are clean, the child's hands are clean, I will grab my clean diaper. Now, using the wipes does not replace hand washing. So I will be washing her hands immediately after getting her dressed in our diaper changing sink. I'm going to wet her hands first. Again, apply soap to one hand and the other, and then begin washing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Then I'm going to rinse her hands. Grab my paper towel and dry her hands off thoroughly, and use my paper towel to turn off the water. Then I'm going to put my child back to the play area, and I need to come immediately back to my table because my hands are still dirty and I need to clean. I start to clean the surface with soap and water first. I'll apply that to the surface and wipe it down. Throw that into the trash can. Then the bleaching water, apply that to the surface. And we're going to let that set for at least 2 minutes. My hands are still dirty from cleaning and changing a diaper, so I will wash them now. Wet first. Soap. Again, 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Rinse. And use the paper towel to turn off the faucet. Now, while the bleach is still on my table, I can grab the diaper changing log because my hands are clean. I can report what I just changed, and I'm ready to begin again.
So now we're going to talk about toileting. Preschoolers. Preschoolers will be taken to the bathroom according to their individual needs, and that means when they need to go to the bathroom, they need to be taken to the toilet and so that they are able to go to the bathroom. After toileting, each child's hands shall be washed with soap and running water, as well as our hands need to be washed with soap and running water. Something to think about as you're thinking about your new position is, where are your bathrooms located for the children? How are children going to be supervised during their bathroom time? What is the plan for that? How does your center handle that? Feeding of infants and toddlers. You need to make sure to label everything with the child's name as it comes in. Bottles, nipples, spoons, and bowls shall be cleaned and stored in a sanitary and sterile manner. All open jars of baby food shall be sent home at the end of the day or discarded. You're going to follow the infant meal plan pattern guidelines when providing meals and snacks. I realize that this may not be something that you are actually responsible for. It may be something that's more managerial. However, you will still be implementing that, so you need to be aware of the infant meal pattern guidelines, and that's also attached to this PowerPoint presentation. Infants shall always be held while bottle feeding. Bottles should never ever be propped. After feeding, you want to document the time and the ounces that the child has taken. Feeding preschoolers. Food shall be placed on unbreakable dinnerware or napkins for certain snacks. Children shall be seated while eating. No child shall be forced to eat. Children shall not be allowed in the kitchen at any time. Meals and snacks, including portion amounts, will follow the preschool meal guidelines. And once again, that preschool meal guideline is also attached. Food safety. For allergies, you need to be allergy aware. Your allergy list should be current and up to date. That means up to date as of today. And you need to know what the appropriate response is for any type of accidental allergen intake. And what that means is if one of your children accidentally eats something or come into contact with something that they are allergic to, what is the plan? It does depend on what their typical reaction is as to what the plan needs to be, but you need to know what that is. Does it involve an EpiPen? Is it alerting their parents because they are going to be maybe having diarrhea later on in the evening? Or if it's a skin issue, if they're going to break out in a rash, their parents need to be aware of that. So you need to find out what is the response should a child accidentally come into contact with something. And for each child, it may be a different plan of action, so you need to be aware of what that is. Another food safety area that you need to concentrate on is that foods that may cause choking shall be prepared appropriately for the age and ability of each child. Grapes are always cut in half. Hot dogs are cut lengthwise and then chopped. And the following foods are only served under very close supervision. That's peanut butter, because the reaction can often be immediate and severe in those cases. Small pieces of raw vegetables, they can pose a choking hazard, so that needs to be under close supervision. Foods with bones can also present a choking hazard, and popcorn as well. So we always want those to be under very close supervision. Next is sleeping for infants. How often are sheets changed and cribs cleaned in infant care? Infants will be allowed to form his or her own pattern of sleeping and waking. To lower the risk of SIDS, which is sudden infant death syndrome, caregivers must place infants on his or her back to sleep. Once the infant can turn over from back to front, they must be placed on their back, but are allowed to adopt a preferred sleeping position. A snug-fitting sheet is the only item in an infant crib. Next, we have a video that's going to talk to us about safe sleeping patterns in relation to SIDS.
Halo presents Baby Care Basics and Sleep Tips from author, mother, and pediatrician Dr. Tanya Altman.
20% of SIDS cases actually occur in daycare when a baby is outside of his home. So don't forget to remind all caregivers, including grandparents and babysitters, these safe sleep practices. It's important to help reduce your infant's risk of SIDS and suffocation. Wherever your baby sleeps, consider these safe sleep practices. Make sure your crib is safe. Remove all soft bedding and toys from your baby's sleep area. Place baby to sleep on his or her back at nap time and at nighttime. Offer a pacifier at bedtime to babies who are more than 1 month old after breastfeeding has been established. After feeding, put your baby back to sleep in their separate safe sleep area. Never place your baby to sleep on any soft surface. Make sure your crib is sturdy and safe. Do not depend on baby monitors to reduce the risk of SIDS. Do not allow smoking around your baby. Do not let your baby overheat. And provide tummy time when your baby is awake. Thank you for taking the time to learn about how you can decrease your infant's risk for sudden infant death syndrome.
The Halo Sleep Sack Wearable Blanket keeps babies sleeping safe and sound. Find it at Target and Babies R Us stores or by visiting haloretailers.com.
Next, you can see our chart of infant sleeping deaths, and you can see how infant deaths have decreased drastically since we have implemented the Back to Sleep program. However, it is still not at zero, and that is the reason we must be diligent in how we put our babies down to sleep. Next, we're going to talk about nap time for preschoolers. We want to be sure and frequently check our preschool children. At a minimum of every 15 minutes, you should go around and look at each one of your children to ensure that they are asleep and that everything is okay with each and every child. You want to have a light on in the room so that you're able to monitor them and that you're able to see. You need to remember to be alert. Nap time is not social hour. You should not be out of the classroom visiting. You should still be in the classroom within eyesight of your children at all times. Now we're going to switch gears and talk about illness and injury. Your children's immunization record. Up-to-date immunization records are required for each child in your program and should be kept in your preschool office. Administering medication. Anytime medication is administered, there is a medicine authorization form, and you need to make sure that you review those procedures about administering and storing medications. There's forms your parents have to fill out in order to do that. In some centers, you may actually be the one required to do that. In other centers, it's the director or an assistant director that actually administers medication. But you need to be very familiar with the medicine authorization form and for the procedures for administering and storing medication, both in the minimum standards and your center's policies, especially if you're going to be the one administering the medication. Ill children may not remain at the center. The definition, what is the definition of illness within your program? And when and who do you call? What is the procedure for that? You need to be very aware of what this is within your own program. An accident and injury report. We have an accident and injury illness report attached to this from the minimum standards. You need to make sure that you fill out this report anytime there is any type of accident or injury. You also need to make sure that you're following your center program's policy on reporting injuries. First aid and CPR. There is someone on site at all times that is first aid and CPR certified. If you are not that person, you need to make sure that you know who is on site when you're there that is the certified person. Most centers now try to have several people certified, if not everyone. It's really better if you can have everyone certified. That way you're not wondering who your first aid and CPR person is today. Poison control. We're all very familiar with the 911. However, that is not the number for poison control. Make sure the number for poison control is posted by the telephones that you have access to call in case of an emergency. Shaken baby syndrome and head trauma. The shaken baby syndrome is injury to a baby that is caused by being shaken violently and repeatedly. Shaking can cause swelling of the brain, internal bleeding, detached retinas leading to blindness, mental retardation, and even death. Head trauma. What is head trauma and what are the symptoms? Head trauma is defined as an event where the head suddenly and violently hits an object. For example, if a child falls and hits their head on the floor, or when an object pierces the skull and enters the brain tissue. Head trauma is very common in young children, the kind where they hit their head, obviously not the kind where an object pierces the skull. But concussions from head trauma can be difficult to recognize in infants and toddlers and very young children because they may not be able to describe how they feel. They may feel different, but they don't have the ability to tell us that through their words. So nonverbal clues of a concussion are the things that we have to look for. Those nonverbal clues of a concussion may include appearing dazed, being listless or tiring easily, irritability or crankiness, the loss of balance and unsteady walking, crying excessively, a change in eating or sleeping patterns, a lack of interest in favorite toys, and last but certainly not least would be vomiting. If a child vomits after having any type of bump to the head or fall where they've hit their head, then that is an immediate sign for a concussion. But the other things that you look for are the things that we just mentioned: the appearing dazed, listlessness, irritability, crankiness, loss of balance and unsteady walking, crying excessively, or a change in their eating or sleeping patterns. Anytime you notice any of these things, you need to contact a parent and let them know. Now, sometimes a child may have some of these as part of their normal personality. You know your children best. You know when they're not themselves. And it's at those times that you particularly, very specifically need to contact parents and let them know that there is a change in the behavior and that they have bumped their head, and let the parent make the decision about seeking medical care. Next, let's talk about indoor safety. Make sure your parents are using your sign-in and sign-out sheets. You're only as good in counting your children and making sure that you have everyone when you're moving from one area to another as your sign-in and sign-out sheets are filled out. If they're not filled out completely, then you may not have all the information you need to keep your children as safe as possible. When indoors, we want to make our environments safe. We want to keep doors closed and pathways cleared. We want to have easy and simple rules for the children to know and to follow. An example of simple rules are: we're going to walk when we're inside. We're going to use quiet voices when we're inside. What safety checks should you do every morning? Every morning when you come into your classroom, you should look around at your space. You want to check and make sure that there's no small objects on the floor that could cause choking. You want to make sure that there is nothing going on with any of the electrical outlets. If you have water in your classroom, and most of our classrooms do, you want to make sure that there's nothing going on with any type of plumbing where there's water out. Take a look around your classroom each morning and just do a simple safety check. We want to keep hazards also out of the reach of the children. Hazards are any items that can hurt them, from chemicals to scissors. And we want to make sure that these items are kept under lock and key. Our indoor safety slide asks, where should these items be kept? Under lock and key. And all containers shall be labeled with the name of the substance or the material that is contained within there. We have an article attached to this: How Safe is Your Classroom? Identifying Hazards Before Accidents Happen. You need to be sure and read that and think about your individual classroom as you're starting in your new position. Next, we're going to talk about emergency preparedness and response. What are the different types of emergencies? Well, in the state of Alabama, we have tornadoes, fires, earthquakes, yes, even earthquakes. We actually do have a fault line that runs through the state. A utility emergency, this includes electrical, gas, water. An active shooter situation. Does your center have a plan for what to do in an active shooter situation or a robbery? Your center needs to have a plan for each and every one of these. So whatever your program's policy is, whatever their procedure is for each one of these emergencies, you need to know that and know what you're supposed to do and how you're supposed to handle each of these emergencies with the children. One of the most important things to remember, should any of these things occur, is to stay calm. Not only do you need to stay calm for yourself so that you can execute the plan well, but you need to stay calm for the children so that not only are you going to need to keep them safe, but you're also going to need to keep them calm as well. So if you have not heard anything about an emergency preparedness and response plan for each of these items, please be sure and ask at your next day. Remember, never ever leave your children unattended. If you need help, ask. Always, always do head counts. Never have your back to the children. Teach your children the classroom home rules because you want to create a safe environment that is made for exploration. Now let's talk about going outside. Outside safety, the inspection of the play area. Once again, this is like entering your classroom. When you enter the playground area shall be checked daily before children use the area. Even if there's someone assigned to check the area at the beginning of the morning, you still want to check it as you're going out with your children as well, because there could have been something that has happened during the day since the initial check and the time that you've gone out. You want to look for broken equipment, broken glass, large sticks, animal poop, anything that could be a hazard for your children. For playground supervision, you need to ask yourself, can I see all the children? Can the children see me? Can you hear the children? Can the children hear me? Do you have playground rules? What are they? Are your playground rules for caregivers and teachers only, or are there playground rules for the children as well? You need to know both sets of rules. Let's get outside. When do you go outside? When the weather is permitting. We need to be outside as much as possible. As long as we don't have lightning or raining, we need to let our children have time to experience the great outdoors. Why do we go outside? Oh, there's a multitude of reasons. Children love being outside. They need to be outside. They need the fresh air. They need to be able to run around. They need to release some of their energy. Spending time outside is developmentally appropriate for our children in so many ways, and so valuable. They need that time, and you need to remember that even on days when we don't necessarily want to go out, or we're tired, or we don't feel good, we need to take our children outside. Child care providers need to be actively involved in the children's play on the playground as well. This is not a time of the day for you just to come to check out. And we also need to remember, as we were saying, how important it is. For some of our children, the only outdoor time they receive each day is at preschool, because by the time they get home, it's dark. Mom and dad are doing supper and trying to do laundry, and they're not able to take them outside sometimes. So sometimes the only outdoor time they have is while they're with us, and we want to provide them with those opportunities, and we want to keep them safe during those opportunities as well. If our program transports children, you need to be aware and to read the required parent information within the minimum standards for transporting. If the center provides transportation or activities away from the center, a written statement signed by each child's parents or guardian shall be on file in the center prior to the child's participation in such activities. The statement shall indicate that the parents or guardians have been informed that the Department of Human Resources does not inspect activities away from the center, and the center assumes full responsibility for such activities. Attached to this, you will find a vehicle inspection sheet. You need to review the sheet and be aware of the things that you need to check on the vehicle each and every time you have children on there. The transportation checklist, there's also a copy of that attached to this slide. We want to look at that and review that every time we're getting ready to transport our children. We need to know who's on our bus or our van, and we need to know everything about them. We need to be conscious of the fact that we are transporting them, and what is the plan should different things happen. For example, an accident, how are we going to make those notifications? What is our plan of action should that occur? Educating parents about vehicle safety. For parent education, we want to talk about placing something in the back seat with a child when a parent is when a parent is transporting a child. Especially for parents who don't typically transport the child early in the morning and late in the afternoon. On average, 37 children die each year from heat-related deaths after being left in their vehicle. Now, I'm not talking about the cases where a child is left on purpose or something like that. I'm talking about the accidental cases where a parent has gotten distracted, or their mind has gone onto autopilot and they have continued on to work instead of dropping off a child that they may not normally drop off at preschool. We always, in order to prevent those situations, want to have an item that we put in the back seat when we have a young child in the car with us, whether that be the phone, whether that be our phone, whether it be a briefcase, something that we're going to need at work, whether it's our shoe, so that when we get ready to step out of the car, we have our shoe in the back seat that we have to retrieve as a reminder that we have a child in the back seat, that we need to make sure that they are kept safe and are dropped off at preschool. So educating our parents is a huge part of our responsibility in the child care field. So we want to take that seriously and follow through with that. And we need to remember that focusing on health and safety is part of creating a stimulating learning environment for our children to explore. And that's the reason we want to keep health and safety uppermost in our minds.